I think we've got enough of a quorum. Why don't we maybe jump in and get started? Brian, do you want to start us off? And I should also, just before we get started, we do have a note here just to note for everyone that we plan on recording the session. It's the one important way that we can capture the best input from attendees. And Brian, I'll let you take it from there.
Okay, thanks very much, Andy. I'm Brian Mhsa. I'm the Deputy Director for Evaluation and the CIO for the Mental Health Services Oversight and Accountability Commission. I want to also acknowledge that we have on the line here this morning Chair Lynn Ashbeck, Chair of the MHSOAC, and Toby Ewing, our Executive Director. Really pleased to have so many of you joining us this morning for this conversation. This is the second data forum we've held. We had one back in the fall before we launched a set of new dashboards, and we're taking another swing at it with 5 new dashboards that we are presenting here for conversation about look and feel and content and feedback to help us shape those dashboards further before we go live with them later this spring. The Commission's mission is to work in partnership with stakeholders to drive transformational change in California's behavioral health policies, practices, and outcomes. The approach of our Research and Evaluation Division is to use data to inform communities about behavioral health wellness over time and across the state to help those communities set priorities and goals and assess progress. This comes in 2 primary parts. First, a top-down community or population level assessment. This is essentially a public health approach. We seek to benchmark and track key aspects of public health over time relating to particularly to behavioral health. By assessing their status in various public health domains, communities can identify their priorities and set goals for improvement, including in the MHSA community program planning process. Second, a bottom-up assessment and tracking approach. What are communities investing in, for whom, in what ways, resulting in what outcomes for participating consumers? Today, we will introduce you to some new draft dashboards, building toward this top-down and bottom-up strategy. Our team will be asking for your feedback on our first community wellness dashboard, focusing on suicide deaths. And we will be asking you for your feedback on several new bottom-up dashboards addressing aspects of MHSA-funded programs and services with a special emphasis on full-service partnerships. We're focusing on full-service partnerships today because they are by far the largest programmatic component co-funded by the MHSA. And I apologize, I did this in the wrong order here. I should have introduced the team first before I launched into my spiel. So I'm going to finish the spiel and then introduce the team, and then we'll jump forward. FSPs are designed to provide comprehensive, whatever it takes services to the members of our community who are most in need of help so that they can continue to live independently in our communities. California invests about $1 billion per year into FSPs across MHSA, Medi-Cal, realignment, and other funding sources to better ensure that persons with serious mental illnesses are better able to live full, independent lives. The broad flow of the bottom-up dashboards today will be from general to specific. We will share with you new dashboards that explore a bit of some of the data on who is being served in MHSA programming for persons with SMI or children with a serious emotional disturbance, some of the characteristics, including service needs of children and youth entering into the full service partnership service system, some of the performance data on FSP programs as represented by county reporting on FSP assessments conducted, and lastly, some high-level outcomes assessment for FSP clients leaving their programs. Let me introduce the team here. Dr. Dante Early is our Chief of Research and Evaluation. Andy Krakoff, who kicked us off just a couple of minutes ago, is our contractor on this project and has been really leading our formation of the approach to the data forums, and has conducted a number of interviews and small group discussions with a variety of stakeholders connected with these developments, including our prior set of dashboards we released last fall. If you go to the next slide, please. Dr. LaTanya Harris is one of our key leaders on our research and evaluation team, and will be hosting one of the breakout sessions later today. Heather Barr recently joined us as our triage summative evaluation data manager. We'll be leading one of those breakout sessions. And Mike Howell is one of our UC research and data integration, well, he is our UC research and data integration manager on contract with us from UCSF. Next slide, please. So this is where I launched up prematurely on the introduction. I apologize for that. I noted that MHSOAC's mission. The vision is a very robust and ambitious one. It's well-being for all Californians. And that's where the research and evaluation team comes in, is in how do we build data tools and easy access to available data to help the public participate meaningfully in the community program planning process, to help interested stakeholders understand what's being achieved through the MHSA, both in community planning and in leveraging other funds and in outcomes for individuals being served by those programs. So we need both the top-down approach of understanding what we're trying to get done in broad strokes in our communities, as well as the bottom-up approach of what specifically are we investing in and what outcomes are we achieving through those investments. And we hope to meet in the middle with strategic planning that links the goals of communities with the specific investments they're making. I want to turn things over now to Dr. Early to give you a little more context of where we're going from here. Oh, before I do that, boy, it's early for me somehow. Before I do that, I want to remind you a little bit about some of our existing Transparency Suite dashboards. Some time ago, we released a new dashboard on criminal justice involvement of individuals in full service partnerships. And the key finding from that dashboard was that there is a noticeable relationship between FSP participation and reduced rates of arrest, namely the rates of arrest during FSP partnership and for the 12 months after individuals exit an FSP. Those arrest rates are substantially lower than the arrest rates we observe for those individuals before they enroll in FSPs. We are hoping to delve further into the FSP space to have a better understanding of what drives those outcomes. And some of the conversation today will touch on directions to help us do that. We also have several dashboards that delve into who is being served in what is known as the CSS, Community Services and Support component of the MHSA, programming for individuals with severe mental illnesses or children with severe emotional disturbances. And those dashboards include some exploration of the demographics, both overall and within full service partnerships. We have done some benchmarking of those demographics compared to other measures of population demographics to support the exploration of service disparities. You can go to the next slide. And we've also addressed in a preliminary way inventorying MHSA funded programs statewide. We're continuing to work on that inventory and that descriptive structure to help us explore the nature of investments across the state, identify clusters of programs that are trying to do similar things for similar clients in similar ways, to better understand best practices in programming and help drive learning communities across the state. And I believe we have one more slide on our existing programs, and that has to do with MHSA finances. And I think many of you may be familiar with these dashboards that build off the county revenue and expenditure reports. We have two sets of dashboards currently on our website. One is a bit out of date, built on revenue and expenditure reports. We anticipate launching a new and improved version of that dashboard early in April that will provide a much longer history of county revenues, expenditures, and unspent funds through the MHSA, through the 18-19, and soon after that in the 19-20 fiscal year data. And we also have a dashboard that tracks allocations from the State Mental Health Services Fund to the counties over time to help the public better understand the flow of MHSA funds. We hope in the future to be able to build into that set of tools further information about realignment fund distributions, Medi-Cal expenditures, and the fuller array of resources that are available to the community mental health system. But we're not quite there yet. Now, I think I'm ready to turn things over to Dr. Early. Thank you.
Dr. Sela, you are perfectly timed. I mean, just on point. Thank you so much. That was a great introduction of the work that we have done, as well as the vision for where we are going. So thank you so much. You saw quickly the agenda flash up. And we are now going to go into the new data and really the underlying data that will be informing the dashboards that we will be presenting today. I did see in the comments, can you post the dashboards? These are actually draft dashboards. And so that goes to the point that I'm going to highlight right now, which is that the way that we work here in research and evaluation at the Commission is that we genuinely want to know whether the work that we're doing and the way that we are not only just ingesting the data, but analyzing the questions that we're asking of the data and then presenting to stakeholders in the public. Is this the way that is useful for you? Is this accessible? Are we asking the right questions? Are these dashboards user-friendly? And so that's really what we're doing here. So everything that we are presenting really is draft. Now, obviously, we've put it in the dashboards and we've gone through and we've thought about it and worked internally, but now we're coming to you. So these are not final, and that's why they're not. The link is not going to be posted because all the feedback that we get from you guys today, we're going to take that and then try to incorporate that into the dashboards and then release them after getting your community input. Okay, next slide. So to start us off, you heard Dr. Sela talking about this top-down community level approach. And so one of the dashboards that we will be highlighting today is our suicide incidence and rate data dashboard. So this displays information on state and county suicide incidence and rates from 2010 to 2017. This actually is using publicly available data from the California Department of Public Health's Epicenter website. And so the 2017 year is as recent as they have data available. The slicing and dicing that you'll see on this dashboard, you'll see the suicide incidence and rates at a age group level, cause of injury level, race to ethnicity, as well as gender. And so we will be, again, diving into it in that way. I do want to note while I'm on this particular dashboard that, again, we talked about this top-down community level and also from who are receiving services at an individual level data, connecting that as well. And so in the coming months, we will actually be receiving data from California Department of Public Health from their death records, in which we will be linking causes of death to our mental health service data that we'll be exploring in the next couple of dashboards. And so not only will you get this community level top-down approach, but we will also be able to say something about mortality rates as well as incidence of suicide at an individual level rate for mental health consumers. Okay, next slide. So with that being said, how would you use these data on suicide rates to inform your work? And can you share some examples with us? We've opened up the chat box in Zoom for you to share your input. And so please also share what type of work you do when you're sharing examples, and also how potentially you would use this dashboard and this data to inform your work. And then I might need some help on, let me see if I can pull up the chat box without it interrupting you guys. Okay, so far I don't see any chats in the chat box on how potentially this data could be used to inform participants or those who are here, the work that they do. And so some examples, okay, hold on. And so I see, let's see. So I see one person is posting, Jerry, our county has trouble getting suicide rates from currently or recently incarcerated folks. Okay, so that's a really good point. For us, as you may know, that we link our data to Department of Justice data as well. And so we will have, hopefully in the coming years, a system of linking across at an individual level, criminal justice, death records, birth records, as well as education and employment. And so that's something it sounds like would be helpful for people. Looking at increased rates will inform the need for additional services. Okay. Janine posts that this would be helpful to understand suicide risk and prevalence and target developing programs for the most at-risk communities. Let's see. Pre-coalition members, peer training, and assist and attempt survivor support by demographics, culture, and language. Okay, so language be helpful to add. What about deaf, hard of hearing communities? I see posted from Richard. Identify hotspots using data to support legislative requests and proposals. That's helpful. From Dana, I see we are using suicide-related data to identify populations that are disproportionately impacted based on age groups, race, ethnicity, and gender. Okay, this is great. And hopefully this data and dashboard can be used to support that. And then where the high rates are, this is from Michael, where the high rates are and to target our suicide prevention efforts to demographics. Over time, it should inform us of effectiveness. Okay. So keep putting things, I see 12 more messages, keep putting things in the chat. I am going to move on to our next dashboard, but we are getting all of this information that you are putting in the chat, so please keep it up. And then I think, is it Kayla or Rachel, you are separating the chats by the name of the dashboard so that we can see once the feedback stops on one dashboard and starts on another. So let's see, thank you, Rachel. Okay, so our next dashboard is the full service partnership child indicators dashboard. And so this is a dashboard that I'm hopeful the public and you all will find useful. So when you enroll in a full service partnership, as many of you know, you are given an assessment at the very beginning that asks about what are some services that you need and what are some of the areas that you need support in. This particular dashboard takes for children and transitional age youth only. That information that's gathered on the assessment, how are you coming to the program? What are some of the environmental stressors that you have experienced before you've even gotten here? Takes that information and we're putting it in a dashboard to give us a better understanding of children and TAY that are FSP children and TAY before they even enter our mental health service program. And so on this dashboard, you'll see indicators like homelessness, emergency services, inpatient psychiatric emergency services, legal involvement, out-of-home placement, school grades, school attendance, special education, and substance abuse. And again, this dashboard will be explored in the breakout sessions. What you'll see there is if you click on one of the indicators, so for instance, legal involvement, what are the issues broken down by race, ethnicity, gender, even age within child and TAY, and the percentage represented in some of these indicators. And then how do these indicators intersect in and of themselves? We'll also see this at a high level at the state level, and then also at a county level. And so again, hopeful that this information will be real useful, again, for understanding the stressors that are experienced for full service partnership children and TAY before they even come to the program. Okay, let's switch to the next slide. And so the question that I have for you here is, how would you use these full service partnership child indicators in your work? Can you share some examples as well as what your actual work is, type of work that you are doing? Okay, so I'm gonna scroll up just in case I have missed some of these. Okay. All right. So to be complete, it is very difficult to adjust current programs based on 3-year plans, based on 4 to 5 years old data that must be addressed. Even if numbers aren't final, we could use preliminary data now for research purposes. I think this might be related to our suicide dashboard. Okay, for FSP, are we tracking children with foster system experience? That's from Michael. Yes, we are. And so you will see that we will ask about foster care or foster system experience on intake, as well as we track that, I think, in the key event tracking form, as well as the quarterly form as well. Okay, from Elizabeth, per capita costs, actual services offered, rates of utilizations. Okay, I see from Richard, is there a breakdown of specific disabilities under special education? The deaf, hard of hearing community, including whether have mental health needs. That's not something that I've seen us have available to us, but I want to look a little bit more into that, Richard, but not that I know of to answer that question. Impact, where, let's see, MHOS, school-based programs, I think that's probably MHSA, maybe school-based programs have been instituted. Okay, that is very, very helpful. Let's see, for the suicide, are we tracking the person's health insurance? There's a need to track to see the effectiveness of private health insurance and PI efforts. Okay, I see from Jane, looking at disparities across and retention by racial groups, long-term tracking to adulthood ACEs, absolutely. And that's exactly, Jane, what I was thinking in regards to this dashboard as well, was understanding for children in TAY, some of these adverse childhood experiences, and then looking at them through the system. Again, we will have data from CDE, which is the California Department of Education, Department of Justice, Employment Development Department, as well as death and birth records. So really getting a systems look at children through the programs. And then last one, please track peer specialist work too. All right, thank you so much, Michael. Let's move on to the next dashboard. And then please, if you can continue to post chats and feedback in there. Okay, so next one is Reasons Partners Exit, a full service partnership program. So if you have followed our journey here at the commission and our dashboards, you will know that in some of our early releases of our dashboards, our very first one of our very first ones, we did release an outcomes dashboard. And on that, there was one figure that captured reasons partners exit a full service partnership program. We have taken that one figure and expanded it out. This is, you have what are the reasons for discontinuations by type. So did partners meet their goal? They just simply discontinued. Did we lose contact? Under other, they could have passed away or moved. And then obviously under jailed or institution, are they in a state hospital, or again, are they incarcerated? Again, we've expanded it a little bit. And so now in this dashboard, you also get to see average months in a full service partnership by the discontinuation reason, and then the average length of the partnership as well. And all of these data are available at a county level. So on this particular dashboard, we ask again, how would you use these discontinuation data in your work? And please share some examples. Okay. Okay, so I see a question from Angela Vasquez, which is, are there plans to integrate this type of data collection in the other MHSA funding streams, particularly PEI, since the regulations are being rewritten this year? So within the PEI data that we currently collect, we get it at an aggregate level, not an individual level. And so couple things, it would definitely be, I think, helpful and useful to collect this kind of information. And so that's definitely something that we can put as a want and a need. I see from Richard, does individuals receiving FSP as a parent with mental health data analysis? Okay, and so it currently with the data that we have, we're unable to see for the most part. There's some proxies that we can use, but for the most part, we're unable to see whether someone is a parent or not. Again, for the most part. We will actually be getting birth records data from vital statistics from CDPH in the coming months. I already mentioned that we're going to be receiving death. We'll also be receiving those birth records. And so for the first time, we will actually be able to identify parents throughout the decades that we have data for. Let's see. I see follow-up 612 maths postdoc, months postdoc. Okay. Let's see, from Steve McNally, how does the California Open Data Portal across most state agencies figure into supporting these dashboards? Really good question. Could you put the dashboards back up? Full service partnerships are holding people longer than planned. So this is a couple of things right here. So we are actually going to talk about full service partnerships and assessment data, I think actually next. And this, I think we'll touch on this a little bit as far as tracking folks. And then I also think that from this, you can see a little bit, at least of those who exit, how long they were in the program. But this is helpful to know that maybe potentially you would want overall average length just across FSPs period, not just of those who exited. Okay, for Jerry, since nearly 1 to 5 are jailed as a reason leaving FSP, it would be great to drill down into much finer detail that cohort experience so we can identify potential interventions, especially because the criminal justice costs are significantly negatively impacting counties and the state. We do have Jerry, a criminal justice dashboard. We will hopefully be updating that pretty soon, but we actually do drill down into full service partners who have experienced arrests and looking at those demographics. And so we can definitely drill down a little bit more into some of this with some of that administrative data that we collect on arrests. All right, and I'm gonna keep going if only for time's sake. But thank you guys so much. And again, please keep those comments coming. Okay. So our next one, I think I might have just touched on it, is our full service partnership and client services information assessment data dashboard. So these dashboards were created in response to the COVID-19 pandemic. We wanted to get a better idea of what we were hearing from providers, and what we were also seeing was, and hearing anecdotally from consumers as well, were that, again, because of the pandemic, because we were isolating, because things were shutting down, that services were declining. And so the primary motivation to look at this data was to understand, okay, are we seeing services potentially declining? And so we have a KET, which is the key event tracker for full service partnerships. And this really is a form that covers specific life domains such as residential status, if there was a change, was there a change in employment, emergency room visits, arrests, discontinuing from the program. So there's no limit to the number of KET forms that can be completed. So when something happens in the life of a full service partner, it's captured here on the KET. And then you have the 3M. It's the quarterly assessment. And this really is a form that tracks a quarterly form that's completed every 3 months, again, for full service partners, clients, for the duration of their active partnership. So once a partnership is established, every 3 months, this quarterly form is also supposed to be completed. And it captures some of that information that was on the initial assessment, kind of like we talked about homelessness services, arrests, so criminal justice involvement. So things that may not have been captured in the key event tracker or also may have, should also be captured in the quarterly form. Okay, let's keep going. I know I'm getting, Brian, you did so good on time. Okay, so that actually leads me to Andy, and Andy's going to talk more about our full service partnership assessment dashboard and our client services information dashboard as well.
Great. Thank you, Dante. You did great on time too. And you did good on time, despite the fact we got such amazing feedback from everyone. And I just wanted to take a moment to thank everyone for that feedback. It's probably not possible for us to note every single comment here as it comes in, but please know that after the event, we're going to be closely reviewing this as a team, and it's going to greatly inform next steps. So yeah, as Dante said, I'm just going to take you on a little bit of a test drive, a little bit of a demo of the 2 new dashboards that are related to assessment, just so you can see them, and then we'll also have a little bit of time as well to ask you some questions about those. So this first one that I want to share with you is this particular dashboard. Let me scroll up. The Client Services Information System, monthly clients served. And as Dante mentioned, this dashboard really came to mind from this notion of what is the pandemic causing in terms of clients served by month. And before you perhaps jump to a conclusion, and I want to point you toward this trend graph and say, there's our answer. The trend graph is showing us, that there is less clients served. This dashboard actually, interestingly, pointed us towards a different conclusion, which is that we don't yet have all of the data we need to understand that, because it takes counties a varying amount of time to provide the data. And so the reason why you see the decline is not so much yet, we don't have the data yet to say if there's less clients being served. We're just basically waiting for the data still to come in. And that's really what this dashboard is showing, is when, and you can see it here on the map, is when were the last data provided by an individual county. And this bar graph that you see here will break down that on the whole, most of the data we get is between 4 and 6 months old. It's coming in, I should say 4 to 6 months. And one other thing to point out is that the most, these data coming from DHCS, they actually were provided December 1st. So when we say, or they're coming December 1st. So when we say it's 4 to 6 months old, it's from that particular date. So this gives you a sense, though, of when counties are reporting their data. And so that's the purpose of this particular dashboard. And let me give you an example. If I click on a particular county, you can see here, hold on one second, let me see if, there we go. You can see this is now we're looking at Riverside County. I was just picking one particular county. And you can see that they are contributing, and you can see how much they contribute to that portion of the bar that's between 7 and 12 months. So that gives you an indication of where they are located. In CSI, someone was just asking, what is that client services information? I see that. And so one of the things that you can see here is that there is a big drop off. And that drop off happened in right around here in January and February 2020. And again, remember, what we're then saying is that this was the last time that the data were reported. And so that's the core point that we're making with this dashboard. Again, this dashboard will be launched along with the rest. So it's not yet available yet. And it will be available soon enough, probably in the coming 2 or 3 months. I want to show you another dashboard. This dashboard now is looking at the full service partnerships and looking at the information reported through those partnerships, through full service partners. And let me walk you through this for just a moment. First of all, with this particular dashboard, there are 2 broad indicators. This first one that we're looking at right now is data that relates to percent that have, in essence, any contact, the percent of partners that have had any contact, regarding their full service partnership. And then we have another indicator of the percent of the overall quarterly assessments that were done, or that should have been done, the percent that have been completed. And so those are the 2 right there. The last year for the data is fiscal year 1920, but of course you can look at data that's that's before that point. I want to point out a few things that we're seeing on this. First of all, you can get the map of these data, as you see here. What you see in the trend graph, in essence, I think that's really telling an important story. That the number of partners, yeah, that's on the rise, but the percent of partners that have had any contact at all hasn't been keeping pace. And then as you scroll down, you can also see the information, in this case by race and ethnicity. And you can see that there have been places where there have been that particular racial and ethnic groups, communities of color, are having declining percentages of reporting. Overall, we're seeing declining percentages of reporting. And you can see how this plays out for particular racial and ethnic groups. Now, we don't just have data by racial and ethnic group. We also have data, as you can see here. Now, this is only going to update the bottom trend, the bottom bar graph. But you can see, actually, hold on one sec. Let me go back. Waiting for it to update for me. There we go. You can see the age breakdowns now. And you can see the child, we have transitional age youth, that's the bottom one in yellow. And you can see the reporting for those groups both over time and compared to each other. The black line represents the overall line for California in that particular year. And finally, I'm just going to show you one more. You can see place of birth, for example. All of these data as well, you can get for the other indicator that I mentioned. Here's the place of birth data. The other indicator I mentioned, you can also get all of these data. So there's going to be a whole lot of data available. You can finally pick your county. I'm going to pick a county that happens to be very well performing. In this case, you can see that the trend graph looks much different. There's less of a gap there between the percent of partners and the percent of partners that have had any contact, any assessment, any key event. So that's just a really quick overview. And with that, we want to take a moment and ask you some questions. I think we're going to put some questions up on the screen. Then we're going to also have some opportunities for you to add in your feedback. I see you've been doing that throughout, which is wonderful again. But if you can take just a moment to answer these two questions, we just are curious to see your answers about this. I'll give you a moment to answer them. I'll read you the questions. How has the COVID-19 pandemic impacted the amount of clients served? This is your best guess, or perhaps based on what you know in your community. Second, how has the COVID-19 pandemic impacted the frequency of services? I'll give you another minute, and then we'll take a look at the results. All right. Do you think we have enough of a response, Rachel? Can we flash up the responses that we got? There we go. First, how has the COVID-19 pandemic impacted the amount of clients served? It's really interesting to see that that there's a tie between fewer clients were served and the amount of clients served was about the same, or were about the same. And the interesting thing that I want to point out about this is that as we showed you with that first dashboard, we don't have an answer quite yet to this, as we are still waiting for some counties to be able to report their data. But it's good to sort of see where people's minds are at about this. And then secondly, and someone asked how many respondents there were. I don't know if I have that, if we have that information handy. If you do, Rachel, if you're able to post that as well, we'll get that after the fact, but if you're able to post that, please do. How has the COVID-19 pandemic impacted the frequency of services? And this one was certainly closer, with the 38% of folks saying that clients they thought were being seen less frequently, compared to 33% who said they were seen about the same, and 29% that clients were seen more often. And I'm seeing some comments in here about 25%, this is from Elizabeth, increase in contact for crisis team. And so this is all really helpful. 21 people responded overall. So I think that seems to be about 1/3 of the respondents. If you want to take a moment and put your response now in the chat box, you are more than welcome to. But I am going to move on now, and we have some questions here that we wanted to ask you. Now, again, we're looking at here about these data on assessment, the data that we're getting and how frequently and when the data are coming in. So we're curious to know what new challenges has COVID-19 introduced in collecting and submitting the MHSA data. Any thoughts there on that particular question? Please put it in the chat box if you have any thoughts there. I'm seeing some nice thoughts that are coming in, and it's great to see, that for example, on youth suicide, having age breakdowns by K through 5, grades 6 through 8, etc. Janine, we initially observed sessions and so instructed our direct care teams to increase the frequency. Once we had more success, we would have sessions via video versus phone. Session count and total number of service minutes increase. It's really good and really interesting to see that color regarding this is, I think, to the previous question we had. So thank you so much. Providers are in crisis mode, and NHS reporting is not high on their priority list. Yeah, I think that probably summarizes the vantage point from a lot of folks, Jen, so thank you. When we look beyond COVID, though, What other challenges, this is the second question now, what other challenges do counties and providers face when collecting and submitting MHS data? So this is speaking to challenges beyond the here and now, the pandemic that we're dealing with. What else do you think have happened or has happened or will happen or always has happened when collecting and submitting MHSA data? Let people put comments in there. I see the comment about staff not being motivated. Jerry, you are, I think we're having an early response to that third question, which I will get to in just a moment. The communities of color statement is troublesome. One would think we'd be more inquisitive given the significant rates of negative impact on those communities. The lack of reciprocity. I'm just seeing some of these comments as they're coming in. A comment from Janine, managing the different documentation timelines and being able to share the outcomes of the data in a timely way with any direct care staff. Benjamin, we give data but don't get info. Interesting. Elizabeth, statisticians are not familiar with the clinical side, so not always asking the most important questions. Really helpful. It does help us to see this, sort of on the ground vantage point. So thank you. I want to move on to, please keep answering that question, but I do want to move on to the last question, and then we will go into breakouts. We see declines in trends in tracking and engagement for clients from communities of color. Any thoughts about why that may be? Well, I'm looking at people still submitting from the last one. Budgets are tight and staff capacity is challenged. Folks are working more than usual. Jerry, my concern is that there is not a standardized API, application programming interface, allowing counties to connect data sources directly to DPH and by extension made available. Benjamin, the data lives in isolation, and if we want to parse it at, say, the program level, we cannot. And we cannot have the data we submit. Can you explain more about this last question in regard to where you are seeing these trends? Let me just show you, let's just go back here quickly and show you, let me go here. If we look at these data, let me get beyond Sacramento. Oh, if we look at California and see these data, we can see that there are, you can see the differences among the racial and ethnic groups in California in terms of frequency of reporting any event. And that's what, in that question, this is what we're referring to.
Before you leave here, and so what you'll see at the bottom is that for fiscal year 10-11, and for African Americans, and quite honestly for other and Latinx, that slowly those bars are getting further and further away over the years from California's average of tracking. And so what that means, again, is that when we're looking at assessments and partner engagement and key event tracking and 3M tracking, that at least for communities of color, there seems to be less tracking, assessments, engagement happening over time. And that's what you see at that bottom for, again, when you look at race ethnicity.
A good way of putting it, Dante, further and further away from this vertical black line that represents California as a whole. Is that reflective of lower access? That's an interesting question there, or shifting populations.
So one of the, this is Dante again, one of the things, or I think earlier in the comments, it said something along the lines of, hey, can you, all of these dashboards that you have together, you know, you have to consider them all together. And so we have a dashboard highlighting differences to understand disparities that's currently posted, in which you can see within demographics, within full service partnerships, within the CSI data, within those who are qualified for especially mental health care, and within the census data overall for California, broken out by race, ethnicity. And what you actually see as far as enrollment is that it's pretty steady enrollment across these racial ethnic groups. And in fact, when you look again, compared to CSI, those qualified for especially mental health care, for African Americans and for the Latinx community, the enrollment does not seem to be the issue. And so when I see, is this reflective of lower access? It depends on how you're defining access, right? Is it that you are enrolled in the program? Or again, if you start to look at this tracking, is it that you, again, are being tracked and engaged over time? And so that's a very good question.
Yeah. Well, this is, I'm glad we were able to spend a good bit of time on these data. I do want to give us a chance to have some conversation in breakouts. And the notion there, and don't worry, we're going to look at some of the same dashboards and some of the same comments you just have been commenting on, the child indicators data, the suicide data, et cetera. So what we're going to do is we're going to split into 4 groups now. And we're going to have some smaller group conversations regarding these dashboards. We'll have about 45 minutes. We've got 3 dashboards to share, so 15 minutes per dashboard. And then we will come back for an open session. Those of you that want to stay, still have questions. We want to also use that time to just, you know, have a conversation about what we heard in the breakouts. And we wanted to give you a chance to add in your comments that for whatever reason may not have made it in during the conversation up to this point. So 45 minutes in the breakout and then some time for open conversation. Great, and I think we'll probably be starting to split each other off into the 4th. We'll just give it a few more minutes for folks to get in from the breakouts.
I needed more time, Andy.
I needed more time
Always
as well.
more time.
I also ran out of time. I was flying through the discontinuation when because I got through the screens, but I had to go through it pretty quickly.
And my group had a lot of questions. My group had a lot of questions right out of the gate. So we also ran out of time.
It's a good thing. I mean, in some respects, it's not good we ran out of time, but we've still got, you know, 15, 20 minutes here, and we can, I think everyone's probably back now. We can continue the conversation a little bit. And so let me just start it out, because I think one of the first things we want to leave this, in essence, kind of like as an open discussion, but we also want to leave this as time for report back on what we heard, and not just what, you know, we didn't have a chance to get through. So I was in Heather's group, and I'll just take a moment to just share some of the comments that I heard in that group. And this is in no particular order, and this is very high level. But you know, some of the comments were about the functionality. Some people wanted, or the layout or the design, like bigger fonts. So there's some very practical things there. One person was commenting that how valuable the regional data is. I think this is this is one of the first times we've done the regional data, I think, right? Or has that been on some of the live dashboards already?
It's on some of the live dashboards. But I think what you're getting with some of these is we're starting to really dig more into outcomes. I think most of our dashboards that we currently have are like more demographics, characteristics of our clients. And so now you're starting to again see more outcomes of this data. And I think that makes the regional data more interesting too.
Yep. Of course, not surprisingly, and we do get this every time we do these sessions, there was additional data. People want more and more and more data. I remember seeing the foster care data and integrating that, and not just more data, but better breakdowns. So that's all points well taken. Obviously, there's limitations in terms of the data availability, but it's always helpful for us to see that. And sometimes I heard some questions that were along the lines of, could you please clarify some of the data definitions here? What year is the suicide data, for example, or is it a calendar year? Is it a fiscal year? Those kinds of questions. And that helps us just to know how we can put, those are easy fixes, yes, but they also help us understand what we can do to the dashboards. Heather, anything else that you heard that you know, takeaways that you don't think I mentioned from our, not to put you on the spot, but anything you heard from our breakout?
No, I think in general, we just had a really excellent group who, you know, loved discussing the dashboards and the functionality, and that really the reasons for exiting the full service partnership, I think really was good information for people to be able to have and digest. I did have a question that I wasn't able to answer in the chat, and I do apologize, but I was asked for individuals who select that they've declined to state their race or ethnicity, what group are they in? Are they in the white other unknown?
So Mike, I'm gonna answer to the best of my ability. I'm pretty sure they're in unknown.
Okay.
Yeah.
For the FSP and CSI data, we put them into unknown. If there is an option for the person who enters that data to select other, and so those are in a separate category. So if they're in other because the client didn't state, it'll be in the other group. If they didn't decline to state and they just left it unknown, then that's where they go. I think for one of Shing's, I think he combines other unknown with white in one category, which I know is a pretty common practice I've seen in other dashboards and data presentations.
Excellent. Thank you for answering that question.
And I'm seeing comments, you know, come in, and please just keep them going. This is an open session. And I especially wanted to highlight the last comment that's in here. I would encourage you to think about, it's from Elizabeth, how you would hope this info will be used, and let that guide what and how the data is presented. It's such a valuable consideration, and hearing your conversation today definitely points us toward that direction. So thank you. Let's, Mike, anything that you heard in your session that you wanted to highlight?
Yeah, I think one of the things that we heard, we had a lot of good comments, was that we had a lot of interest in the suicide and especially the child indicator dashboard. We had a lot of good comments from that. I think one of the things with the child indicator dashboard that I liked is I think we should, on the dashboard itself, be more clear that it's self-report and when they come into the program, so people use it as such, right? Because we just want to make sure that it's getting used in the proper way. So I think that was really interesting. And then we had a couple suggestions for maybe things we could also add, like whether they were in a conservatorship, right? And so we may want to take a look at some other reported data to see if we want to add to that. And Brian, is there anything else I'm missing? I know there's a lot of interest in the suicide dashboard for when we get the detailed data, because it was mentioned that it's often underreported, right? So when we get the detailed data, maybe we look at some other different reasons for death, that like overdoses, could be suicide, could be overdose. So just some reporting around that, and some notation that is often underreported in the broader data.
Yeah, a couple other quick points that I would highlight. There was a suggestion that maybe we post a copy of the PATH form, so that, you know, people have the ability to look at that and better understand where the data is coming from, and, you know, how the questions are being asked. I thought that was a really useful comment. And then there was some discussion about suicides in carceral settings, and Ashley highlighted that when we have that individual level data, we should be able to drill down and have a better understanding of deaths that are happening in carceral settings. There will, of course, be questions, and there were questions raised in the group about the quality of that data and delays in reporting. But that I think that's an important question that we'll want to address, linking consumer histories to deaths in carceral settings to have a better understanding of that in the long run. It's not something we can do in the short run, but something that we should certainly think about in the longer run.
I'm looking at some of the comments too as they're coming in. So first from Jerry, another really sort of just very important and general comment, that there are users like him, he says, that do not have that scientific background. And so to know information about how to use the data, why some data is not provided, how data can be misconstrued, how valuable that can be. And then just a general question that I can pose to the group, and then we'll go to the third breakout here from them, is for the suicide data, will suicide attempts also be included? Is that, I would imagine that information is hard to get, or is it obtainable?
Brian,
I had answered that briefly in that in the future, Dante has lots of plans for us to get additional data. One of the things we're looking for from OSHPD is getting emergency department and hospitalization data. And from that, we can attempt to sort of dive into that, so, but we're not there yet. And we're hoping to start those requests later this spring, summer, and maybe by the end of the year, early next year. You never know how long these things take. We would actually get that data and we could start diving into that.
That's good. Thank you, Mike. I see Susan put in a comment regarding Latanya, your breakout group, and that is the third breakout. And Dante, I don't know if you were also in there, but if one of you or want to share what you heard, that'd be great.
Right. So I just say that we got some excellent feedback on the importance of clarifying data terms, sources, timeframes. We got some ideas on how to make the dashboards more user-friendly. So making sure that the map colors differentiate from the bars if they are not related. We got some feedback about filtering by language if possible. So someone noted that language can be a barrier to services in some counties. So having that detail where we have it, or adding that detail where we have it, would be useful. We also got feedback about incarceration, so suicides for those who are incarcerated. And we just got some interest in being able to drill down into the data, so by race and age group and other subgroups. So that was what we got.
Good. Elizabeth, I like the point that you're lifting up from your breakout, how data can be misused or misconstrued, perhaps for an ideological or policy preference. So accuracy, specificity with the explanations is helpful. Yeah, that's sort of building off of the prior comment. So thank you for that.
Andy, can I take that comment / question?
Absolutely. Yeah.
And so one of the things that we are trying to do is have what I would call a layered approach in how we are providing information. Having the data dashboards, I think, is extremely helpful, particularly if you're comfortable with data, or even if you're sort of a novice user. But I think one of the things that's being noted here is important, which is, how do you really interpret this data, especially if you aren't necessarily data savvy. And so what you'll see in the coming months is that we will be releasing data and research briefs that take a little bit of a deeper dive into the data, and we'll touch sometimes on potentially, maybe not misuse, but misunderstandings of the data, and also the potential to use it for policy and advocacy. We'll also be using these data dashboards and putting out infographics as well. So if you just need, I just need high level 1-2 points of, why do I care? Why should I care? How can I use this information to support the work that I'm doing? And so that work is going to be coming out in the next few months. Anyone who is familiar with our research and evaluation journey here knows that we've worked really hard in the past couple of years to build our data infrastructure and begin to ingest these state level data sets, again, to have a better understanding of connecting systems that mental health consumers touch, and using as our role here at the Commission to bring that data together so we can really better understand the impact that services are having on reducing things like school failure, suicide, unemployment, being unsheltered or unhoused. And so while we've been doing that, and we've been really working on pushing out the data, our next point of reference is going to be how do we then support interpretation of the data that we have been working so hard to get and analyze and clean.
That's helpful. Thank you, Dante. Jerry, you've been adding some interesting comments. And I think you ask one that is, become more important in this age of data becomes more machine analyzed. And you're asking if the algorithms or formulas are open and available. And I don't know whether honestly that applies to these data here, but I think it's worth just talking about for a minute. Dante, I don't know if that would be you or someone else.
So I think it depends on when I see algorithms and formulas, I immediately think of our SAS data programs, which we always have no problem making available. I think it's probably helpful to understand that many of the measures that we're reporting on really are either simply one questions, or even, for instance, our full service partnership child indicators dashboard was based on work that a contractor had done, actually working with the counties to design a reporting system using DCR. And so we took reports straight from that because it was work that had already been done over a course of time with the counties, and it was familiar, and created dashboards off of that. Much of the work that we are doing is in regards to the measures and the variables, if you want to say, is publicly accessible. And so if it's how things are defined, we have a glossary for that. If it's our actual programs, I know this is something that Dr. Sela is really big on, which is, can we share just how we've programmed these things, which we absolutely can. It's probably a very, very small audience that's interested, but we can definitely always post our SAS programs.
And
Yeah,
the methodology section, Dante, might have a more user-friendly write-up of here's what we did and how we did it. That's available, will be available at the bottom of each of them. Then if for folks who are interested, we can obviously share the coding too.
Yeah, and I can speak just very briefly here to add on to what Dr. Early shared. Most of what we're sharing at this stage is descriptive information. So they're categoricals or other relatively direct measurements or direct reports, rather than indices or other constructed variables that might come out of an algorithm or a machine learning process. So we're not doing a lot of inference at this stage. We're doing a lot of description at this stage. So it's almost everything here is coming directly from the data rather than an interpretation of the data.
That's helpful. Brian, thank you for adding that. Elizabeth, we're almost at time, but I want to make sure I get clarity on this one. You say data about the workforce, education, training, peers, language. Are you talking, just to make sure, you're talking about the workforce of those that are in the system, like full service partners,
providing services?
Those providing services. That was okay. That's what I wanted.
From a service user, I've worked as a provider, as an advocate, and as a service user. From a service user perspective, and I know I just got a report from what is this, California Healthcare Foundation just put out a thing on workforce. You know, who the providers are actually providing the services makes a really big difference in terms of how people are engaged and access. And a lot of times it's like, let's have a program, but the people aren't really trained in it, or they don't, that's kind of where the breakdown happens, you know?
Yep. Yeah, thank you for that. I see we're at time, which is too bad. This has been a great conversation. You gave us so much, you know, input. And I just want to point out the email address is there because, and the reason we wanted to put it there is we understand that you may have thoughts that come to mind after this. And please reach out to us, evaluations@mhsoac.ca.gov, because we're eager to hear your input as we continue to refine these dashboards. Obviously, you gave us ideas for about another 1,000 dashboards, so that's great. But thank you, everyone, for your involvement, your ideas, your insights. Great, really helpful. And have a good rest of your, what day is today? Thursday afternoon.
Thank you, everyone.
Thanks, everyone.